at such I'm happy to be able to speak at such a great support group because as you all know, when you're going through treatment, or your family members going through treatment, it really takes a village to get through all the different components and working together with patients and family members and also being able to touch base with other patients that have gone through similar treatments is really important. So I'm excited to talk to you today about radiation therapy for breast cancer. Today, we're going to focus on general radiation practice. What is it? Why is it used for breast cancer? Some of the advancements of radiation therapy and how to manage side effects and really what to expect as you're going through these treatments. So I'm a Southern California native and I did my training actually at USC, so nearby. And then now I'm here with City of Hope in the Sherman Oaks Clinic and also with Providence St. John's in Santa Monica. So objectives for today. So we'll be discussing, so what exactly is radiation? Why do we use it for breast cancer?
Sorry, Dr. Vassantachart. I don't see the slides.
Okay, let me try share again.
Yes, please.
I see them.
Oh, you see them?
I do. I saw them.
I see them as well.
Okay, great. Now I see them. Thank you. Sorry to interrupt.
No problem at all. But yes, so what is radiation? Why is it used for breast cancer? What do you expect during radiation treatment? What are some of the innovations and how do we support those undergoing treatment? So on the picture on the right here is just a picture of a type of radiation machine that you would see if you were going to go through treatment. Okay, so what is radiation therapy? So radiation therapy is actually a whole gamut of there's different light waves that are used. It's actually a photon or a particle used to destroy cancer cells. So with photons, oftentimes people hear of radio waves, microwaves, then light. Those are all different types of photons. But as the wavelengths get smaller and the frequency is faster, then you have higher energy light. And that's how we actually use radiation to kill cancer cells. So what it does is when the radiation comes in, it's this high energy light, it comes into the cell and it breaks DNA. What we want is actually a double strand break where it breaks the entire DNA apart. And normal cells in your body have the ability to repair the breakage in DNA because there's a lot of repair mechanisms and proteins that are used to repair this DNA. Cancer cells, on the other hand, they are missing some of those repair mechanisms, and that's how we kill the cancer cells while actually the normal tissue cells around it are healing. So that's the goal of the radiation treatment. And in general, there's a lot of different stages of breast cancer. So the treatments are very tailored to what stage you are. But in general, it's a combination of chemotherapy, surgery, and radiation or endocrine therapy. And if you're early stage, then that's when either just surgery alone, surgery plus radiation is used. If you're more later stage and have an advanced cancer, that's when potentially you use chemotherapy or immunotherapy upfront to shrink the tumor before surgery. And then at the end of that is when you do the radiation to kill any type of residual microscopic disease. So why is radiation used in breast cancer? So in the past, when breast cancer was first found and treated, everyone used to get a very actually aggressive mastectomy where they would take away the breast tissue and the chest wall and all the muscles in that area. Slowly over time, we were able to tailor those treatments more to what the actual stage of the breast tumor was. And now often women are getting what's called breast conserving surgery, where they're able to only take out the part of the breast that has the tumor instead of a mastectomy. So in those cases where you have an early stage breast cancer and they take out only part of the breast tissue, we add radiation afterwards to kill any type of microscopic disease that could be left over. And that's how we get outcomes that are similar to or the same as a mastectomy with having a smaller surgery, but adding radiation for the same survival. After having a partial breast surgery and not the full mastectomy for early stage breast cancer, in general, when you add radiation, it reduces the risk of recurrence by about 66%. So, from a risk of 30% down to 10% with radiation, and then with additional hormone therapy, you can reduce that even lower. But that's the general goal of radiation for early stage cancer. For more advanced breast cancers, when the tumor is very large or going into lymph nodes, then after surgery or even a mastectomy, we add radiation to kill again those microscopic residual tumor cells that could be there. And that's how we improve survival and reduce risk of recurrence. So what is the actual process of radiation treatment? If there's any questions also during any of this, then feel free to speak up and I can answer them during the talk. But this is the general process of when you first hear about radiation, it's typically after you've been diagnosed and you've seen either surgeon or you had your biopsy results that show that you have a breast cancer. So either you're seeing the radiation oncologist before your surgery or after your surgery, but with the consultation, that's when you discuss the timeline of the radiation, and the final plan of the radiation treatment will actually be done after surgery. So after surgery, we look at your pathology results, see exactly how large the tumor was, if there's any lymph nodes involved, and that's how we decide the actual timeline of the radiation treatment. The next step for radiation treatment planning is what's called the CT simulation, and that's the planning scan that we use to actually set up the treatment to make sure the treatment's very precise during radiation. After the CT scan, there's typically about a week or two of planning time, and then that's when the physicist, dosimetrist, we're working as actually a big team to make sure the treatment's very safe, and we look at all different parts of the body to make sure the radiation's only going to the areas that need treatment. After that is when the radiation therapy actually starts, and there's a whole gamut of different options for breast cancer. The good news is that when you have a lower risk breast cancer, you have a lot of options because over time you've tried to de-escalate treatment to really fit individualized patient care. But it does often lead to patients making a lot of choices. So being able to talk to your radiation oncologist and talk about these different options is a really big component in making sure that you're getting the right treatment. In general, the three main types of treatment are partial breast radiation, where you treat only a small area of the breast, and that's typically over 5 sessions of radiation therapy, versus whole breast radiation, where we treat the entire breast depending on your risk factors, and that's over 3 to 4 weeks of treatment. And then there's, if you have nodal disease where the breast tumor has gone into the nodes as well, then we treat the breast and the regional lymph nodes in the armpit region and by the neck. And that's a 3 to 6 week course of radiation treatment. So during this initial consultation, oftentimes it can be very overwhelming. There's a lot of information that's discussed at once. So often it's helpful to bring a little bit of a notepad. People often have questions listed so they don't forget it during the consultation. But if there's questions after you speak to your radiation oncologist, you can always call their clinics and they can give you additional information even after your consult, because it does tend to be a lot all at once. But important information to disclose to your radiation oncologist. So things that are a good idea to bring up is if you've ever had radiation treatment in the past, it's very important for your radiation oncologist to know that. If you have a pacemaker or an implantable heart device, that's also a very important feature that we would work with cardiologists to make sure that we give safe treatment. Any connective tissue disorders like scleroderma is also important to disclose information about. And also if you have a family history or a germline mutation that's predisposing you to cancer, that can oftentimes play into the decision-making for radiation as well. So what are important things to ask during your visit? You can ask for what is the benefit of radiation? Is it for reducing my risk of recurrence? Is it for improving my survival? And oftentimes when you get more information about these factors, it can help you really tailor the radiation treatment to what your goals are. It's important to ask how many treatments are needed, what are the short and long-term side effects, and we'll go over those different side effects today, but each treatment is a little bit different, so the side effects, depending on your stage, can be different depending on what needs to be targeted with the radiation treatment. Another important question to ask is there a technique that can be used to decrease radiation to my normal organs? Oftentimes centers now have breath hold techniques where you can actually take a deep breath in and move the breast tissue further away from the heart and lungs. So this is a very good option to have when you're undergoing radiation treatment. And it's important to know if the facility that you are going to has some of those options. So some of the common questions that people ask before they start radiation treatment is, will I be radioactive? The answer for external beam radiation is no. So the moment the machine's off, there's no radiation anywhere. You can be around people, you can be around children, and you can't give anyone any radiation. Um, Other questions are, what can I do during radiation to make the treatment more effective? In general, just doing your normal activities and actually staying a little bit active every day can help your body tolerate the treatment better, but there's no special diet or special creams that make the radiation more effective. What we don't want you to do is take supplements that are high in antioxidants, because that could potentially interact with the radiation treatment. So if you are taking supplements and have questions about specific antioxidants that you're taking, you can always bring that up to your radiation oncologist. They can take a look at the actual medication or supplement to see if it's potentially going to interact with the treatment. What can I do during radiation to prevent side effects? So we'll go over some of the still recommended creams, but there are a lot of creams that you can use over your skin to help reduce the redness and any burning sensation during radiation. Another common question is, will I lose my hair? So you don't lose your hair from radiation on your head. Occasionally, depending on the treatment field, the hair in your underarm area can actually be a little bit lighter after radiation, and it tends to grow back about 3 months afterwards, but the radiation doesn't affect the hair on your head at all. How long will each session of radiation be? Typically, you're in the department for about 30 to 40 minutes, but the radiation itself is less than 10 minutes. So it's very quick, and most of the time that you're actually on the machine is for setup, making sure that you're in the exact specific location where we can aim the radiation beams only at the breast tissue. Can I still take my medication and supplements? Most medications are completely fine to take, but your radiation oncologist will review your list of medications and supplements, and they'll be able to let you know if there's anything that's going to be interacting with the radiation treatment. All right, so as we were talking about the CT simulation, this is that planning scan where we really map out your body and we see where the breast tissue is, the heart and lungs are. We make the radiation plan based off of this. So this is done before the radiation starts, and we put you in a very specific position. Typically, it's with your body and a bag that holds your body in a very specific area and 2 arms above your head. Oftentimes we place small little stickers that go around where your scar is and where your breast tissue is, just to help us define a little bit more clearly where your breast is. So this is a picture of that bag that's used. So it's just half your body. It's nothing that's enclosing, but it makes sure that you fall backwards and lay down in the same position every day. And this is an example of the actual images that we get after the CT simulation. So you can see here, we can see breast tissue here. So this is the right side and the left side, and this is in the middle of the chest. So this is breast tissue here. And when we're doing these planning scans, we're looking at where your ribs are, where your muscles are, where your lungs are, where your heart is. And all of that information is actually fed into our system, and we make the radiation plan based off of all this information to make sure that we're aiming the radiation right at the breast, and we're off structures like the heart and lung as much as possible. And oftentimes we're really able to have very minimal dose going to the lungs when we're doing techniques like breath hold techniques. So during the treatment, you'll go and lie down in that same position. So the radiation therapist will align you to the same position as your CT scan. There's often a machine that looks like this that will come from different angles and add the radiation treatment. So nothing's touching you. It's not an enclosed space. You can see around the room, but you do hold still during this treatment. And each session is approximately 20 minutes that you're lying down on the table, with the radiation, again, less than 10 minutes. In general, you receive the same amount of radiation each day. So when we make the radiation plan, we actually know the final dose that we want, and then we spread that dose out over multiple days. What that allows us to do is actually, it's called going low and slow with the treatment. So giving a low dose of radiation to kill cancer cells while the normal tissue recovers around it. Again, there's many different options now, but typically the treatment's about 4 to 6 weeks. If you're doing something like partial breast radiation, where it's only a small area, that's when we can actually give a little bit higher dose per day, and that's why the treatment can be down to 1.5 weeks. So you don't feel any burning, no pain, no heat during the treatment. There's actually a YouTube video that you can go on. It's a virtual reality 360 tour. This is of a machine at the Children's Hospital of Los Angeles, but they have actually an interactive video where you can go drag your mouse around the room and actually see what it would look like to be inside a treatment machine while treatment's going on. So it's a good resource if you just want a little heads up on what's going to be happening during the actual treatment day. But oftentimes, before your treatment too, you can go visit and take a tour of the area to give you a little more understanding of what the room looks like, what the machine looks like, and the positioning that you'll be in for the treatment. So one of the new technologies actually that's growing in most clinics is having the ability to use infrared lights. So these infrared lights actually map out your body structure, and during the entire treatment, we can see exactly where your chest wall is. So that allows us to do breath hold techniques where you can take a deep breath in, you hold it, and then we monitor actually where your chest wall is. And if your chest wall falls, too far down, or your breath holds too big, the treatment will automatically stop. So this allows us to treat the breast when you're in a very specific location in your breathing cycle. So an example of this is a radiation treatment with a breath hold, and you can see that the radiation dose is covering the entire breast. And it's off of the heart and the lungs here, versus if you were just breathing normally, the heart can sometimes be in the field. Again, not all cases do you need to do this breath hold technique, but when it's on the left side or you're treating more lymph nodes, this is a technique that can be used to help to reduce this particularly hard dose. But depending on your anatomy and your stage of breast cancer, this may or may not be an option or a favorable treatment for you. But it is something that can be helpful in situations, particularly on the left side. So with these infrared lights, there's also one of the new techniques is because in the past, everyone used to get tattoos, and that would allow us to align you to a very specific location each day with the radiation treatment. If you have these infrared lights, more and more clinics now are actually being able to do tattoo-less setups where they use these lights and sometimes temporary marks to make sure that you're in the correct position without doing permanent markers. Some patients still prefer to do permanent markers just to make sure that there's no changes during the treatment. But again, more and more clinics are able to actually do tattoo-less setups, and this is important for making sure that we have the optimal cosmetic outcomes for patients as well. So other new techniques that I've mentioned is partial breast radiation. So whole breast radiation, we encompass the entire breast. There's some patients that have a very small tumor with favorable risk features, and those patients can go under what's called partial breast radiation. So new technology has allowed us to be able to give higher doses in a lower amount of fractions to a very small area. So this is an example of doing a very conformal treatment right around about 2 centimeter rim around where the actual tumor was. And depending again on your stage and your risk factors, there's more and more studies showing that survival outcomes are the same and recurrence rates are the same, particularly if you meet the consensus guidelines of low risk criteria. So what this would allow you to do is radiate a smaller area of breast for less side effects with the same outcomes. There's so many different studies that are being done right now to individualize treatment care. So this is a busy slide just showing the gamut of different studies that have been tailoring really the radiation to the individual patient. So in the past, everyone got a very large mastectomy. Then we found that, okay, you can actually do a breast conserving surgery and add radiation. Now we're trying to figure out, okay, low risk patients, we know that they can do partial breast radiation and maybe not the entire breast. And now we're finding even subsets of patients that potentially might not need radiation at all and maybe just endocrine therapy or close surveillance. So, depending on your age, the size of your tumor, all those pathology features, there's studies coming out all the time to really individualize treatment care. Breast cancer outcomes, especially for early stage breast cancer, are very favorable. Their survival rates are excellent. So now we really want to make sure that long-term side effects are not interfering with patients' quality of life. So there's a lot of different treatment options. And one of the new trials recently was actually looking at for patients with more advanced tumors that were in the lymph nodes, if you get chemotherapy before your actual surgery, if you have a complete response, then we can actually tailor and make the radiation a lesser amount because you've had such a good response with just chemotherapy already before having the surgery. So lots of different features to speak to your radiation oncology about, but the treatments are actually becoming de-escalated in a lot of senses to match patients and depending on their responses and the earlier stage that they are. So there's some current studies that are looking at oncotype scores, which is a risk assessment score to see if there's a risk of the tumor coming back either locally or distantly, and being able to tailor radiation based on that. For HER2 positive tumors, there's also studies looking at potentially not doing radiation in those settings, or maybe not doing radiation to the lymph nodes, depending on your oncotype score too. So a lot of work in motion to try to make sure that treatment is as individualized as possible. So, there's a lot of de-escalation treatments, but where is there treatment escalation? So there's been big advances in tumor treatments, particularly with systemic therapy and being able to shrink tumors before the actual surgery. But there's actually ways that we can help with more advanced disease with radiation as well. So there's a growing body of evidence for doing ablative radiation, even for metastatic disease. So with breast cancer, if it's very late stage or if it's at a stage that it's moved to somewhere else in the body, there's a type of metastatic disease that we call oligometastatic. So that's very different than having disease all over your body, like multiple lung lesions. If you see 20, 30 lung lesions, that may be a very different picture than a woman that has breast cancer with maybe just one lung nodule. So if you have a limited lung nodule, we do have the opportunities because of advances in our techniques to do ablative radiation to metastatic portions of the body as well. So these studies continue to be done, and there's more and more evidence, and we're trying to figure out exactly who is the right person to do these types of treatments on. But this is an example of a patient that has a lung metastasis, so a breast cancer that's spread to the lung, has only one area and it's been stable in other regions of the body. And we're able to give ablative radiation to just this area here to kill all the cancer cells there. And even with these techniques, we want to make sure that the patient's still on their systemic or immunotherapy and is getting surveillance scans. But the goal is to actually be able to kill enough of these metastatic tumor cells to prolong survival and prevent recurrences in these areas as well. So another question that's often asked is, what is the correct diet or activity restrictions that I need to do during treatment? So in general, there's no dietary restrictions. We want you to maintain about the same weight throughout treatment. The radiation doses are calculated based on the amount of breast tissue that you have, and maintaining your same weight helps to keep that very accurate. But a standard balanced diet is appropriate. Again, we want you to avoid supplements high in antioxidants during treatment. Radiation actually uses oxygen particles and oxidation to kill and break the DNA. So theoretically, if you have too many antioxidants, then that can detract the efficacy of the radiation treatment. But normal foods like blueberries or foods that have antioxidants in them are completely fine to eat. It's when you're taking a lot of those components and putting them in a small pill that you can potentially have a high amount of antioxidants that can make radiation less effective. So if you're taking any supplements, it's important to disclose them to your radiation oncologist just so that they can take a look at it and make sure that nothing is interacting with the radiation. There's also nutritionists available so that they can talk to you more about dietary needs and making sure you're getting enough protein and a balanced diet as well. It's also important to actually try to do a little bit of daily activity each day to improve your energy during radiation. So as you're going through the radiation treatment, your fatigue will slowly build up. Usually the first week, people are feeling actually quite normal, but the week after that, you can start to feel more tired. You can feel a bit of heaviness. And some people actually take a nap after the radiation treatment to help them with their energy in the evening to improve their energy levels. But doing a little bit of activity or walking every day can actually just stimulate your body to have a little bit more energy as well. Other things to do in terms of activity, though, are to avoid sun exposure over the area being treated. And we'll go into the side effects after this. But with radiation treatment, your skin can get red and darker. And if you have sun exposure at the same time, it can just make some of those symptoms a little bit worse. So if you're out and about, just putting a shawl over the breast tissue or the area being treated can be very helpful in preventing this from occurring. But it's completely fine to be out in the sun as long as you're not having a lot of sun exposure over the area that's being treated. So what are the side effects with radiation? So again, this is something that's very important to discuss specifically with your radiation oncologist. If you look online and you type in side effects from radiation for breast cancer, it might not be a tailored discussion based on your actual stage. So when you talk to your radiation oncologist, they'll be able to let you know, okay, what is my actual side effects based on what's being treated for my case? In general, radiation is targeted though, so it doesn't affect the whole body. It's treating either part of the breast, the whole breast, or the breast and the lymph nodes. So when you're going through breast radiation, nothing's going to your brain, nothing's going to your pelvis or other areas of your body. So the common side effects are feeling tiredness, and then really the most common side effect is getting skin redness. So we like to say it's similar to having a bad sunburn, but again, it depends on your skin type, and there's a lot of different creams that we can use to reduce that side effect of skin redness. But by the end of treatment, there can be redness of your skin and sometimes peeling, and there can even be some oozing spots as well. Hyperpigmentation is darkening of the skin, and everyone's also a bit different in terms of how much darkness they get, but your skin can get darker like a tan. You can have some breast tenderness and swelling as well. And if you're having your lymph nodes that are being treated, it's possible to also feel a little bit of a sticky sensation or some pain in your throat. Some of the long-term side effects of radiation treatment is that your breast and your axillary area can get fibrosis. So your breast tissue can feel a little bit more firm after radiation, and it can also get smaller compared to the contralateral breast. There's a lot of options in terms of symmetry surgeries for good cosmetic outcomes if this was to happen, but it is something that can happen after radiation over a few years. So it's very important to actually do arm stretching exercises and to keep your axillary and your chest wall moving so that this fibrosis doesn't set into the armpit region. There's potential complications with implants or future cosmetic surgeries. So if you do have an implant in place, when you add radiation, that tightness of the breast tissue can actually make the implant painful and make the implant look a bit different. So it's important that you're following very closely with your plastic surgeon if you're getting radiation to an implant. There's the possibility of breast size reduction too, and sometimes your breast can feel a bit more lifted compared to the other side after radiation treatment. There's lower risks of having heart disease or pneumonitis, which is lung inflammation. And the ways that we actually reduce the risk of heart and lung disease is the techniques now for radiation treatment are much more advanced, where we're actually moving the fields as we're giving the radiation to make sure that the dose is really concentrated and homogeneous on the breast and then away from the other structures. Again, if you do have a left-sided breast cancer or a more advanced breast cancer, oftentimes doing that breath hold technique can also move the breast tissue further away from the heart and lungs to make the risk of heart and lung disease very rare. In general, having a cough from radiation is typically less than 1 in 100 people. But again, depending on how much is being treated, that risk factor would be best discussed with the radiation oncologist, but these side effects tend to be actually quite low risk. If your lymph nodes are being treated, it's possible to get lymphedema, and what that is swelling of your arm. So after having surgery to the breast and the lymph nodes, if your surgeon takes out a couple of lymph nodes and then we give radiation to that area, there's less lymph nodes to drain the fluid from your arm into the rest of the body. So the risk of lymphedema or arm swelling really depends on, how much of the lymph nodes being treated with radiation and how many lymph nodes were taken out during surgery. But the best things to do to avoid lymphedema from happening is actually doing arm stretching exercises. And if you see a little bit of swelling in your arm, it's very important to go to physical therapy right away, because there's a lot of techniques they can use to prevent the fluid from getting worse, to reduce the fluid. But once you have actually a large amount of lymphedema, it's much harder to get rid of than really being proactive and taking care of the fluid early. One of the very rare risks of radiation is getting cancer from radiation. So again, with the radiation, it's targeted, it's only in one part of the body. So the risk of having cancer from radiation is only in the areas that had radiation, nowhere else in the body. But the risk is in general about 1 in 1,000 people, 20, 30 years down the line. So that risk is, about a 0.1% risk, so extremely rare. But it's also important to discuss with a radiation oncologist your specific risk factors depending on your genetic status, your age. So there is a range of this as well, but it is very rare. And when we're adding radiation treatment, we want to prevent the cancer you already have from coming back. So, this is taken into consideration when we're thinking about the rare risk of secondary cancer from radiation. So side effect management, what's some of the best techniques you can do to reduce your side effects? So skincare for breast cancer treatment is extremely important. So using moisturizer at least 2 times a day can really help to keep your skin healthy. One of the examples we often give samples of this cream because it is a very good cream in terms of keeping your skin moisturized and also having anti-inflammatory properties, is a cream called Calendula. It's available at, it's over the counter at most stores like Walgreens, CVS, Whole Foods, or even on Amazon is where people can find it typically. But that's something that you're going to use 2 times a day over any area that's being treated with radiation. It's a general lotion, so being generous with the area that's using moisturizer is completely fine. Some people, even after treatment, like the cream so much, they just use it as their routine body lotion. As redness and itching increases, and you'll talk to your radiation oncologist about this as they see you during treatment, then adding actually a steroidal cream. So an example is hydrocortisone or mometasone cream. What that does is it helps to calm down the inflammation and reduce the skin redness. So this is also a good cream that you can use in addition to moisturizers. Not everyone needs, very strong medications for breast cancer. So again, depends on your stage, how many treatments you're getting. But there is a prescription cream called Strata XRT. And what it is a gel that you actually put over the breast tissue and it becomes almost like a flexible wound dressing. So it helps to prevent skin breakdown and it can also treat skin breakdown. So if you're having a more severe reaction, then this can be a very good cream too that can be used for breast cancer and skin health. If you're having any sore throat during radiation, because if we're treating by the neck, the lymph nodes in this area, sometimes you can feel some stickiness and soreness in your throat. There's a magic mouthwash that we can prescribe to a pharmacy, which is a mixture of lidocaine and some other properties that can help to numb your throat. And even taking medications like ibuprofen or Advil can also help with throat pain too. For lymphedema, so swelling in the arm, doing arm stretching exercises and physical therapy throughout treatment and after treatment are very important. And this helps keep the fluid moving out of your arm and keeping your chest wall also from getting too much fibrosis and stiffness. So a question that I get when I see family members is also what can I do for a family member or friend that's undergoing treatment? So it's very important to have a community around you when you're going through treatment. So being a listening ear, connecting your family member to support groups such as this can really be helpful because within support groups, there's actually usually an ability to find someone that's in a similar position to you, similar age, going through a similar treatment, and being able to talk through their other people's experiences can be very helpful. As a family member or friend, it's important to understand some of the side effects, such as tiredness and skin irritation. And, knowing those different features can help you know, okay, when is my friend going to be the most tired? And typically it's right after radiation treatment and then after a nap, then the energy can get better too. And asking if they need any help with, purchasing skin creams can also be very helpful. And it can also be helpful to go on short walks with your friend or family member to just stimulate some energy. And usually that's a 10-20-minute walk that's low intensity. But this can be a helpful exercise, assisting with daily chores, planning balanced meals, And one important thing too is understanding that even after is done, it takes time to heal physically and emotionally. So a lot of people actually experience a lot of people, checking in and caring for them during their treatment, but right after treatment, when the visits stop and there's, less follow-ups with your doctors, then it can be a bit isolating in that time too. So understanding that it needs, the support is a long-term support group that's really needed. And just understanding that it really takes a village. So there's a lot of different avenues for help. So oftentimes your physician can connect you with a social worker. That's where you can discuss resources available for transportation. Radiation oncology appointments tend to be every day for, multiple weeks. So having a good source for transportation is important. Giving you resources for mental health, financial assistance, connecting you to the right support groups. Social workers are very important and can really help to bring all of that together. Nutrition consults can also be very important. Physical therapy, you can always get a physical therapy referral earlier than later, and continuing with physical therapy exercises is very important long-term as well. And even psycho-oncology consults. They're specialists actually specifically for mental health for patients undergoing cancer care. And just knowing that you have these options can be very helpful as you move through this challenging portion of treatment. But yes, I'm thankful that I was able to talk to you today. And does anyone have any questions for me right now?
Thank you, Doctor. So does anybody have any questions? Feel free to unmute yourself and or put your question in the chat box. No. Okay. No questions? Okay, I just put our October program guide in the chat box, and as Dr. Vassantachart said, that we have support groups for people with breast cancer, as well as support groups for caregivers, and individual counseling and psychosocial support is critical, as Doctor said. So we have resources, and then if you're new to our programs, please reach out to us. One more time, any questions? No? Okay. Well, Dr. Vassantachart, thank you so much. And then yeah, participants, this was great. Thank you. So thank you. And then please come back again.
Thank you so much for having me. And if anything comes up and people need to reach out, there's always listening ears that are ready to speak to you about questions about radiation.
Thank
Great.
you.
Thank you again, Dr.
Yeah.
Vassantachart. And then everybody have a nice afternoon and have a nice weekend.
Yes,
Thank
thank you so much.
Thank you. Thank you, everybody.
Thank you.
Bye.
You. Bye.
Thank you, Doctor. So we will post the recording on our website and YouTube, and then I will send that to you and Nina as well, the recording. Yeah.
Okay, thank you so much.
Thank you. Have a good afternoon. Bye.
Thanks.
Bye-bye.